Hey, good evening, Crowfoot Village Family Practice patients and friends and staff. Rick Ward here, one of the physicians at Crowfoot Village Family Practice, also known as the Old Timer. If you logged on and were expecting to see Jason Kenney and Minister Shandro, you're an hour too late, but boy, don't switch off. We've got a great hour for you. I'm here with my co-host, Dr. Ian Johnson, who I will turn the podium over to in a few minutes, and about 5 of our exceptional team here at Crowfoot. We're here to answer not only the questions that have been pre-submitted, some of the questions that we get asked every day, and also to watch the chat. So if you've got questions that come up, type it in on the right-hand side. We'll try and get to them. Be kind, guys. It's been a long day for us, but we'll try and get those questions answered. So you know who I am. Let me turn things over to my friend and colleague, Ian Johnson, to tell you who he is, and then introduce the rest of the team. Ian.
Thanks, Rick. So yeah, you may recall me from other webinars that we did earlier in the year. So I'm one of the other docs at the clinic. I've been here for about 3 years now. And yeah, it's been a busy day. So hopefully we managed to get all of your questions answered. I just caught the tail end of some of the press conference this evening, so still digesting some of that, so we'll try and comment on that as best we can. I'm going to take the opportunity to just introduce the rest of the panel, or just have them introduce themselves. We'll start off with Dr. Reynolds. Janet, do you want to just say a little bit about yourself?
Hi everyone, I'm Dr. Janet Reynolds, another one of the docs at Crowfoot Village Family Practice, and look forward to this evening and hopefully giving you your medical home's view on COVID pandemic and where we are.
That's great, thanks Janet. And Lynn Gillis, if you could move on to you.
Hello everybody, I'm Lynn Gillis, one of the family physicians at Crowfoot Village Family Practice, and to reiterate Janet, Dr. Reynolds' voice here to answer some questions tonight, and hopefully we can get through most of them.
And most of the patients won't get to see very often, but certainly very much important behind the scenes for us is Shauna Thomey. So Shauna, do you want to introduce yourself?
Yeah, thank you. And thanks for joining us, everyone. We're really pleased you're here with us. So I'm Shauna Thomey. I'm the Executive Director at Crowfoot Village Family Practice. Just celebrated 10 years with the clinic, and feel very grateful to be part of such an amazing team, and very happy to be with you tonight.
And moving on to one of our fantastic registered nurses, Alex, do you want to tell everyone who you are?
Hello, I am Alexandra, and I am one of the team nurses on Yellow Team, but I really enjoy caring for all of the patients in the clinic that I get to see, and I'm really looking forward to being able to bring a kind of registered nursing perspective tonight.
And last but not least, by any stretch of the imagination, when you're dealing with multiple respiratory problems, one of our respiratory therapists. So, Amin, do you want to tell us a little bit about yourself?
Oh, thank you. Sorry for the delay.
Ask you to unmute himself.
I mean, I think you've got something muted just in there. I'm not sure what. There we go.
Sorry about that.
There we go. Just start again. So this is Amin.
Yeah. So again, after all, I said everything right here. And my name is Amin Thawer. I'm the respiratory therapist and certified respiratory educator working at Crowfoot Village Family Practice, and very proud to be part of this excellent team. And hopefully we can answer all your questions tonight. Thank you very much.
Thanks, Amin. And so Amin is one of our what we call multidisciplinary team members, and we've got lots of those at Crowfoot, which is something you don't really see at most other clinics in the province. Folks like Amin allow Rick, Janet, Lynn, and all the rest of the docs to focus on a lot of the other stuff, because he's helping deal with a lot of the chronic respiratory problems. It means we can focus on being available to you for other things, which I think is really, really awesome thing about working here. Moving on to the evening's questions. So people are just wondering how things are. And so if I can ask Janet and Lynn to just comment on how COVID is affecting your panel, what are you seeing in terms of COVID cases at the moment, guys? I'll maybe start with Janet.
Thanks, Ian. So it's kind of interesting to me. My benchmark is how many COVID results I get in my inbox, and I've seen a lot of negatives. And interestingly, as we're prepping for today, I've had a few more positives pop up and had to call some of those COVID positive patients. And, it's just a bit sad and disheartening that this is where we are right now, because we also have the increased demand of all the other care that we haven't done for the past 19 months. So it's kind of hard and sad, and we're seeing the rise in our practice. One of the patients I called was unvaccinated. The other patient was partially vaccinated. And so we're just working hard to get through it, and we'll see where it goes after today's announcement.
Thanks, Janet. And how about you, Lynn? Are you seeing a sort of similar picture? I think that's probably what a lot of us are seeing at the moment.
Yes, thanks, Ian. Absolutely. Not even just in the last couple of days, I would say particularly last 2 weeks, a real increase in the number of COVID positive results that I've been receiving through the EMR. And then, like Dr. Reynolds said, our mandate as family physicians for these patients is we must reach out to each and every one of them and determine what their risk is and determine whether we need to keep reaching out to them and continue to have phone calls with them. So that increases demand substantially at a time when we're trying to recuperate for all the things we haven't been talking or seeing patients for. I am seeing, though, and the question will probably come up, so if I can just speak to it right now. I'm seeing all COVID, vaccinated, partial vaccinated, and unvaccinated, and pretty equal across, although the patients that I'm calling that are double vaccinated are at home because they need to be, but they're well, like they really have a little bit of sniffles and nasal congestion. So they're not struggling with their symptoms. But right now, everybody's still at risk of getting COVID. So we still have to respect the restrictions as they take place.
Yeah, thanks. Thanks, Lynn and Janet. And I think my experience in my practice is very similar. I think that in the last week, I have had probably 20 new COVID positives. I'm actually finding most of my COVID positives are amongst vaccinated patients. But I can also tell you that these people have a mild variety. I know that I think it was Nurse AJ that called on behalf of me and spoke to one of my patients, high risk, older guy, has cancer, head cancer. And he said, oh, yep, got the sniffles a bit. He says, but was just out cutting the grass. So, and he was double vaxxed and had mild symptoms. Contrast that with his grandchildren that may have been the source of this. And they had a very different course. And in fact, when you look at the people who are in ICU right now with COVID, they tend to be in that unvaccinated early age group. So we're seeing lots of Delta, and we're seeing it amongst vaxxed and unvaxxed. Ian, I think you were going to maybe check with AJ about what the experience has been in terms of how many of our panel are vaccinated. Maybe we'll turn that over to you and Nurse AJ.
Yeah, sure. So thanks, Rick. So I think one of the questions we were going to ask, so let's actually just pivot a little bit to AJ, if you could just comment, just trying to find that question in my list here.
Do you know where we're at in terms of how many of the staff are vaccinated? If we could start with that.
I'm so glad that you brought this up, because if not, I was going to plug it, because I am so proud, and we all should be. So we are so proud to say that 100% of our physicians, of our registered nurses, of our staff are vaccinated. So we're not just talking the talk, we are certainly walking the walk as well. And we're proud of that.
Sure. And I'm absolutely delighted to be able to sit here in the same room as Rick without my mask on, because I did the right thing and got myself vaccinated. How about the patients? Do we have any numbers for how many folks have managed to get themselves?
We do. So when we surveyed patients about 8 months ago, 4,200 of them had responded. And of that 4,200, 92% of them had said that they were planning on getting vaccinated. And our preliminary numbers support that this is actually happening. The Health Quality Council of Alberta reports vaccination rates to our physicians for their panel. And as an example for you, Dr. Ward, approximately, I think it was 80% of your patients were vaccinated, and that was over a month ago. So most certainly those numbers have continued to increase, which is great. Yeah. And so I wouldn't be doing justice if I didn't say, if for our patients, if you're planning on getting vaccinated, you're maybe one of that 92% who said they were planning to, but maybe you just haven't yet. We really want to encourage our patients to get vaccinated. If you still have some questions, you're a little on the fence, please make sure that you're reaching out and asking us questions. That's why we're here. And if you've made the decision to not get vaccinated, please know that we are always here if you decide to reevaluate your decision and ask us those questions, because we are certainly here to help.
Sure. And what about flu shots? What would we say to people, particularly this time of year, about their flu shots?
Absolutely, still 100% important. We didn't necessarily see the same flu rates that we did that last year, simply because, yes, our patients are getting those flu shots and we want to encourage them to do that. B, there were those restrictions in place, but restrictions aren't enough. So flu vaccines are still 100% important for everyone who's eligible.
Yeah, something that I'd say I've been seeing in my practice and even in my house over the last few weeks is a big increase in those non-COVID respiratory infections, because all of those restrictions and masks that we had in place were helping to keep that at bay. We're starting to see an awful lot more non-COVID respiratory viruses going around, and I do expect that the flu, the double pandemic we worried about last year, I do think we're going to see it. So really, please, guys, go get your flu shots when they roll them out sometime in the next month or so. Over to you again, Rick.
Yeah, thanks. Interesting question. We are seeing more of the non-COVID viruses starting to go around. So I think, as Ian mentions, we may have that double whammy this year. So important to get those flu shots when they become available. Lynn, we talked a little bit earlier about Delta virus and the fact that that's the predominant strain that we're seeing. In fact, I don't think I've seen a non-Delta virus, non-Delta variant in over a month. Is your sense that Delta is behaving differently than the earlier versions of COVID?
I guess it depends what we think different means. To me, it's still COVID, and so it's still the same virus. What's different is its potential for spread, to catch it. It's very easy to catch the Delta variant, and it has increased severity, it appears. It's still COVID and still all this similar huge array of symptoms that could be complained about, but yeah, it's a bad variant. I think that answers that question. Hey, Rick?
Yeah. So what I hear you saying, Lynn, is that much more communicable than the earlier strains, and certainly I'm seeing a greater penetration within households. That often we would see one or two in a larger household of the previous, but now it just if one person has it, that they all seem to have it particularly in unvaccinated. My sense is the severity in younger people also seems to be a little bit worse. I think the jury may be out on that, but right now I'd say it's a bit of a tougher bug. I'm sort of wondering what is happening frontline. Ian, I think you were going to chat with AJ on that one too.
I mean, every time I walk past any of the non-clinical staff, they're just working so hard in the clinic. So AJ, how's things been on the phone? I mean, you're obviously talking to patients on the phone, and I know that you get past a lot of these questions when the team are looking for clinical support.
How are things been while I'm sitting seeing patients in the room?
Yeah, so, you know, definitely on the phones, you're right. There's absolutely a really high call volume. And I 100% agree that our medical office assistants are working so hard to support our patients through this and really doing everything they can to, you know, answer their questions, get them appointments, and really making sure that they're getting the right appointment at the right time with the right provider. And they're working so hard, and I'm so proud to work with them. But yeah, absolutely. You know, we're seeing a lot of the stuff that we saw pre-pandemic in terms of in the clinic, you know, everything from sore ears to well-child checks and periodic health exams. There is certainly an increased volume, I would say, of mental health. If not fully in appointments for mental health, there's certainly that undertone as well. And it's often touched on in appointments as well. And we just want to let our patients know that we're still here, and to give us a call when they need something, if they need an appointment or they have a question. That's why we're here.
Thanks, Alex. And I guess I'd probably add, certainly within the visit, we've been seeing people with multiple issues trying to address, and we're never going to be a one-issue clinic. I would perhaps ask that you think about, you know, what do you want to talk to us about when you come in, so that we can try and be as efficient with the time, and, you know, set that agenda at the beginning. Tell us, you know, everything that you want to talk about, and we will do our level best to deal with all of those things, because, you know, sometimes issue number 1 is the same as issue number 4. But please tell us at the beginning. It makes it much easier for us to address as many of your problems when you do come in. Rick, I think we were going to talk to some of the clinic leadership and just how exhausted some of the team are coming. What have you been hearing?
Yeah, I just wanted to pick up on another comment that you made, Ian, is that I think the phenomenon I'm seeing in the office is people haven't seen me for 18 months. You know, they've got all these things listed that they need to talk to me about. And of course, the first 5 minutes has to be talking about my new facial hair and what's happening with the family. So it's sometimes really difficult to get through that list. But so we really are dealing with a big backlog. And I guess, as Ian alluded to, you know, our staff, our frontline staff, are exceptional professionals, but they're also moms and dad and living in the world too. I'd just be curious, Shauna, what you're seeing from the frontline staff. How are they managing?
Yeah, sure. Thanks, Rick. And you kind of took the words out of my mouth. So the first thing I would say is we always appreciate when our patients check in with us to see how we're doing too. So to those of you who sent in questions about that, thank you so much. I actually chatted with a few staff today just to see how they're doing. And I think the best way to describe it, and I wish I had a better word for it, is they're doing okay. We have a phenomenal team, and this is a great opportunity to thank them. They are working tirelessly. And right now, in what I see as an unprecedented need for health services, we're seeing, as Nurse Alex said, significant increases in phone calls and email requests and appointments. And also, please know, it is a privilege to us to be able to care for you and be with your health journey on you, or with you rather. But our staff are people too. And they're navigating the same things as you are, the same stresses and the same uncertainties. So I think, again, we're okay. And what comes to mind when I think about what do we do? Two words come to mind, and that's compassion and empathy. And I think if we have compassion and empathy for each other, we'll come out of this more than okay.
Really good words. Janet, JR, what are you seeing? What are you noticing in terms of the back of the house staff?
You know, it actually takes a village, that's for sure, Rick. And so it's from our frontline staff answering the phones to our nurses, to our team, to our doctors, to our administrative support who helped put this evening together even. And I agree with Shauna. I think we're all okay, but we're also kind of not okay because this has gone on for a long time. And we're doing our very best. And we do feel honored and privileged to come to work every day and look after our patients. If we didn't have patients, we wouldn't have jobs, actually. So you are important to us, but we do, you know, our call volumes are up and we are very used to being able to offer you an appointment tomorrow or the next day. And we just can't do that right now. Our demand for appointments is up quite a bit. And we are troubleshooting this and problem solving it as best we can and as quickly as we can. But that makes it a bit more complicated. It's really easy when we can ask you to come in tomorrow, but we will get there. We promise you that. And we always strive for improving the care we provide for you.
So, Shauna, call volumes up about 30%. Is that an accurate number still?
Yeah. And Janet and Lynn have both mentioned the word demand, and that's just a phrase that we use to manage your requests. So we don't actually consider them demands, just to be very clear. Those are your requests for services from us. And I would say all around, whether it's phones or email or requests for appointment, generally those are up by 30%. So, and Janet's right, we're okay and we're not okay. I think just like everyone who's moving through this pandemic, but please know we are also doing our best. And we are recruiting as we speak. So we're recruiting physician help and medical office assistants and registered nurses and support for our admin team. So we're doing our best to keep up, and we are here for you.
So in hearing this, I'm okay and I'm not okay, I'm thinking about the mental health impact on our patients. Ian, what are you seeing? And a shout out to our colleagues.
Yeah, so I'm something Janet just said made me want to just give a shout out to some other people that I think the patients don't necessarily think of as part of our team, which is our residents.
So our residents are our medical staff who've completely finished medical school, and they are working with us as they continue their path to be fully qualified family physicians. Today, I had a really excellent resident working with me. She really was awesome. She's yours, Rick, so thanks very much for lending her to me for the day. It allowed me to say, you know what, we can fit in some extra patients here and open up some extra spots. So when you're seeing our residents, I'm saying this with wearing my hat as our education lead, I'm the liaison with the residency program. You're seeing one of us, you're seeing one of the physicians. You don't always necessarily see us at the end of it. You can if you want to. If you even just want to say, hey, hi, how's it going? We'll be almost always happy to step in. But our residents are doing a phenomenal job of helping us to help you to be able to see a doctor today where we possibly can. So again, thank you to our residents. The mental health stuff, it's been crazy, honestly. That ever since the beginning, we were talking about, you know, the fourth wave was going to be the mental health wave, the shadow pandemic. I think we talked about this was long before the fourth wave actually happened. I think a lot of us were hoping we wouldn't have that. So yeah, lots and lots of people are really struggling out there, and I think the new restrictions that have just been brought in will probably just amplify that. Lynn, what have you been seeing in terms of the stress and mental health in our patients?
I think one of our team mentioned earlier, it might have even been you, Ian, that, or maybe it was our wonderful nurse, but it's that we're seeing it both as patients coming in requesting simply mental health examinations or appointments around that, but we also see it, they're coming in for something else, and it's been scheduled as whether it be a short or long appointment. And then they also need to talk about the mental health and side of things. And So appointments are long because that's not when we see patients about low mood, increased anxiety, irritability, sadness, that needs time to listen and come up with a plan to help. So lots of it going on. We see lots of it at any time pre-COVID, but it's definitely increased since COVID. And the other thing that I always, one of our managements for mental health, I always give a prescription for exercise. And a lot of that was removed during COVID for people who are really into organized sport or organized exercise. So in a way, we added things to worsen mental health, and we took away some of their treatment. So something that we're still working on and will be for a really long time with all our patients. And luckily we have a great team. Our behavioral health consultant sees and talks to a lot of our patients. Our nurses talk to a lot of our patients. They do a lot of our follow-up with me. I'll see patients and then I'll send out a note to my nurse to follow up with them in a week or two in between me seeing them again. So lots of team support, which I hope our patients feel that they can come to us and we will help them through this, hopefully.
Absolutely. Thanks, Lynn. And Janet, I'm going to put you on the spot and see if you could perhaps answer Crystal's question there, because the obvious answer is call us, but sometimes your mental health crisis might happen when we're closed. So could you perhaps speak to what resources we've got through the primary care network and through the 811 and so on for people who are having mental health problems? I would my simple answer to you, Crystal, is if you need to talk to someone about your mental health, that's absolutely what we're here for. But if you need help sooner, Janet, what else is available?
Yeah, so thanks for that question, Crystal. Sometimes these things don't happen during our office hours, and if you need help outside of office hours, there's Alberta Health Services has an easy to remember website called Help in Tough Times. You just have to put that in your search engine and you'll see a list of all kinds of resources for mental health, substance use or addictions, and all kinds of things, including a 24/7 crisis mobile phone number. The primary care network offers some mental health workshops that are free and barrier-free. So if you go to cfpcn.ca under workshops, there's happiness basics, anxiety workshops that are free and really well received by patients that participate, as well as the ability to refer for a one-time counseling service at our PCN called One Step at a Time. If you're having an issue during office hours, calling our office to get these resources always the best thing to do, though. Did I miss any, Ian, that you want?
I think that's it. I mean, in an absolute crisis, call 911. The call handlers are trained to direct you to the right resources to get you the help you need if it's an absolute crisis. If you're worried about hurting yourself or worried about someone else hurting themselves, 911 is an absolutely reasonable thing to do. If you have the time to Google the distress centre, the Calgary Distress Centre has a 24-hour helpline for those sorts of crisis calls. But as I say, if we're open, call us. Rick, I think a bit of a pivot to long COVID.
Yeah, before I talk to long COVID, I have to weigh in on the mental health and issues and your comment. I'm going to give another side to this. There's lots of resources out there, but I can tell you right now, they're stretched to the limit because of the mental health crisis that it, in part is because of COVID. Mary, our behavioral health consultant, I believe has a 45-day wait for a first appointment. The private counselors that I refer my patients to in the community are starting to get overwhelmed and are not taking new patients. The eating disorders program, which at one point had a 6 weeks wait, is now up to several months. And what I'm seeing in my office is everything from my number of my elderly patients who have had worsening dementia, which maybe wasn't recognized early in the pandemic, now that they're starting to reconnect with family and get out, some of those functional limitations are showing up. So I've had a half a dozen new diagnoses of dementia in the past 3 months. We're seeing patients with anxiety disorders, some of whom were pretty happy being isolated and sitting at home, but now as things are opening up, or at least we're opening up, are facing anxiety with reintegrating. So there's really a large volume, there's a higher acuity, and although there's lots of resources out there, I think we would all agree that the demand exceeds the resources in terms of access in a time that we would all like them to. Again, we deal with, I would say 30 to 40% of the things that we deal with in the office are mental health related. So this is soup and this is common stuff for us. On to another really happy topic. Amin is here to talk to us a little bit about long COVID. As you know, COVID is primarily a respiratory virus, and there's been lots of talk about long COVID. Amin, what are you seeing in your role as a respiratory therapist and some of the respiratory or lung consequences of COVID?
Hey, thanks, Rick. So just for everybody, long COVID is a thing. It's a small percentage of patients that have been affected by the virus, and it usually carries on for a few months once they've had the virus with residual symptoms. Now, I just want to cover something like most of these patients, they didn't get a chance to have the vaccine, and then they got the virus, and then it's kind of stuck with them in terms of cough, shortness of breath, that sort of thing. Now, I've seen a few of these patients, and the spirometry, the first thing that needs to be done is a breathing test needs to be done. So once we do the breathing test, and the ones that I've seen have all had normal spirometry, right, which is really a good thing. So then I usually book a phone consult within a month or 2 months to see how they're doing. If the problem goes on for longer than 4 to 6 months, then we're usually looking for a community respirologist to refer them to. Normally, after that 6-month period, they are fine from the ones that I've seen, right? So that's the good news of it. In relation to patients with asthma or COPD, we encourage the patients to stay on their inhalers, not to come off their inhalers for sure. And the good news is that these patients I see, they're not asthma or COPD patients. They're normal patients that were hit hard and may have had a pretty severe case with COVID, and now it's just taking longer for them to recover. Does that answer the question?
Yeah, it did. I mean, I think we were really concerned about with the volume of patients with COVID and the sort of noise around long COVID, that we were going to see a ton of those patients. Fortunately, in my practice, and probably several hundred patients who've had COVID, I'm not seeing a lot of long COVID. Ian, how about you? Are you seeing patients that have long-term consequences of COVID?
I'd say I have a handful, but not a large number in comparison to the number of positive COVIDs that we saw.
Particularly in the third wave, I got a lot of positive cases in the third wave. Thankfully, most people were managing to get vaccinated at that point, and anecdotally, I'd say that the Alpha variant, which is what most of those people were getting, was probably not as problematic as the Delta variant. I do think the Delta variant has, anecdotally again, the patients I've spoken to who have been positive sound sicker when they have not been vaccinated. The ones who were vaccinated, it's like it's cold generally. So yeah, definitely seeing some. The respirologists that have reviewed those patients for me have been incredibly helpful for them. One I got actually a consult back on this week seems that she's actually largely a lot better than when I saw her, because it took obviously quite a long time to go through the process of getting to be seen. I was going to turn to some questions we've had as well, if that's okay, Rick. Dorothy asked a question, which honestly I think I've had this several times in the clinic so far, about third shot booster. So if I can address that, the National Advisory Committee on Immunisation, which none of you had ever heard about until about 6 months ago, and now it seems to be like just part of everyday language, did make a recommendation as to who should get it. The recommendation, as far as I read it, is actually broader in Alberta. So our Chief Public Health Officer, Dr. Hinshaw, actually prior to that had gone ahead and ordered third doses for people. I find that most people who are asking me about it probably haven't checked that list and don't qualify under where we would be able to get it. What does the future hold? I don't know. I would anticipate that, yes, we may see a need for booster doses potentially, but as it stands, the information we're seeing both here and around the world is that the 2 doses is still over 90% protective against serious outcomes. I heard Craig Jenny, who's one of the local infectious disease experts, talking on the radio about this afternoon. And the problem is that, yes, that's 90%. When you have a high number of patients with a very transmissible virus, that 90% drops. Your effectiveness of your vaccination is key to how much virus there is in the community. And so we may see more vaccine breakthrough as a result of that. Does that mean we need a booster? No. It means we need more people getting vaccinated to drive that transmission rate down. But yes, at the moment, I'd say most people on this call probably wouldn't qualify. There is a very clear, easy to understand list on the AHS website. I think the main thing that's different on the AHS one is if you're a renal patient who is on dialysis. I don't think NACI included that, but most of our other chronic kidney disease patients, it's a very common problem. They don't qualify for it, and we can't prescribe it to you. It's only available through public health. So that was one question. I think it's one Dorothy asked, and honestly, I've heard it several times. Rick, I think you could potentially ask, I think Brett asked about masks.
Yeah, Brett asked a really good and really detailed question on the evidence around masking. And to unmask the answer to that, I'm going to turn it over to that bright young JR. Janet, what's the skinny on masks?
So I think I drew the short straw having to answer this question. It's really difficult to show proof when you look at masking and effectiveness to reduce transmission, because it's very rarely a single intervention that would be done in a study. So my short answer is yes, masks are effective in reducing transmission. They shouldn't be the only measure that's in place to reduce transmission. Hand washing, physical distancing, staying home when you're sick, those are all just as important. But all around the world, masking policies are widely implemented, whether recommended or mandatory. So, sorry, I'm getting my emergency text alert for the public health orders as I speak to you. Wear your masks. Anyway, that's what I found when I was trying to study up on to answer this question in a thoughtful and evidence-informed way. We at CVFP strongly recommend you wear your masks when you're in public places. When you come to the office, we'll ask you to change to a medical mask. And it makes me hot, and I definitely have some pimples I didn't have before, but I'd rather have that than COVID.
Love it. And we don't see the pimples at all. So yeah, the masks are sort of sucky, but there seems to be enough evidence to support us doing it. I want to get to Patty's question, and her question was, have you seen the Delta variant present the same or different symptoms in children and adults. And maybe I'll start with Lynn. And again, anecdotally, are you seeing these patients with Delta? Do they seem to be presenting differently than the earlier variants?
Oh gosh, if we're just going anecdotally, no. They're still mostly respiratory, cold, congestion, fatigue, fever. And as I think all my colleagues so far have mentioned, those that have the COVID vaccination, much, much milder symptoms. I haven't seen if recently, for a little while, I thought the GI symptoms were maybe bigger with Delta, but I don't know that that's actually the case. So I'm cautious to say that because I don't know if there's actually real data to support that. Maybe you guys know about that. So my only question would be, is GI symptoms actually more common with this Delta variant? And that may be the case. So what do you guys think about that, Rick?
Ian, what's your experience?
So sorry, I was trying to address something in the chat, so I may get back to you to re-ask me that, Lynn.
I think I made my comment too long and it didn't come up. So someone anonymously wanted to know if they were going to get pericarditis from the vaccine. Mm-hmm. The simple answer is, if you've got concerns about getting the vaccine for you, call your family doctor. We would love to have that conversation with you. The very simple answer to that is the risk of you getting pericarditis from getting COVID is significantly higher, exponentially higher than you getting it from a vaccine. Okay. Similarly, Crystal, you've heard about affecting women's menstrual cycle. The vaccine is not affecting women's menstrual cycle. I'll be as blunt as that. Okay. Lynn, what were you trying to ask me that I got distracted?
I'll pick up now. Okay. But I'm here not just as an interpreter when people can't understand his accent, but also as sort of the color guy to pick up those questions. One of the things that's really I found quite fascinating about COVID in general is how different it presents to different people. So let me contrast this with influenza. When patients present with influenza A, sudden onset, striking fatigue, body aches, high fever, and I say, does it feel like you've been run over by a truck? And they say, no, it feels like I've been run over by a truck and then run over a couple of more times. So, that we hear that story consistently with influenza, regardless of the strain. With COVID, it's soup to nuts. I'll have people that'll say, I felt fine until all of a sudden I lost my sense of smell and my taste, and it was so weird. And then the next day I got a stuffy nose, and then the next day I got a cough. Some people say, I just felt really tired and chilled. Other people will present with GI. So I would say that this virus really presents in so many ways. So if you get asked those screening questions and you have anything that's positive, we really are likely to send you to get a screening test. So it's a weird virus and really presents in a number of different ways, which makes the diagnosis even more challenging.
If I could add to that, Rick, I think that particularly while it's so prevalent in the community, the likelihood your respiratory symptoms or even mild symptoms being COVID are much higher.
I believe Dr. Hinshaw quoted something like 1 in 4 cases is all we're catching and through testing, and such that we're not testing enough. A lot of people are not going for testing when they probably should be, I think is what she was saying the other evening. I just briefly touched on people who don't want to get vaccinated. What do we say to them? Certainly I say, talk to us, reading your things off the internet, not super helpful. Talking to someone who's actually spent the last 18 months reading about this from reputable sources would be a good place to go. You obviously talk to people about vaccination for respiratory things like even the flu shot all the time. What are you saying to people when you're talking to them about COVID vaccines? To unmute here.
Oh, sorry. Me.
Was that AJ or me? Myself.
Oh, go ahead, Amin.
Okay, yeah. So I've had quite a bit of pushback in terms of the vaccines. I mean, one of my own relatives doesn't want to get the vaccine, right? So the thing is, there's a lot of, as you said, Ian, there's a lot of misinformation out on the internet, and you have to look at reliable sources like, the European Journal of Respiratory Medicine or the Lancet or things like that. But people are reading a lot into conspiracy theories that just don't exist, right? And then some people are concerned about long-term effects. Well, you know what? There's a lot of things out there that we haven't even studied for long-term effects as it is, right? So right now the vaccine is important. It's been studied. It's effective, right? And in talking to one of the when people tell me this, I try to bring statistics to the forefront if that works. In talking to the division head for infectious disease at the University of Saskatchewan, he says that just like Ian, you said, his stat was 88% effective against the Delta variant, which is great, right? Right now, the unvaccinated, in terms of in Alberta at the beginning of September, 81% hospitalized that are unvaccinated or partially vaccinated, right? COVID cases. 92% unvaccinated or partially vaccinated in ICU. So most of these cases are unvaccinated or partially vaccinated patients. You need to get both your shots, right? And so that is kind of what I go for. And then, 84%, right now, 84% of the deaths in Alberta, unvaccinated or partially vaccinated people, right? So I'm hoping these statistics speak to people and we can somehow convince them to get both their shots.
And Alex, sorry for interrupting you there. If you could tell us what you've got to say.
What I was going to say, from a nursing perspective, when we do talk to patients who are, not wanting to get vaccinated, I think really the thing that we as nurses are doing is just doing our best to really to listen and with an open mind and to be curious about the reasons why people aren't vaccinated. And really encouraging patients to make their decisions based on, reliable, trusted, evidence-based sources. And it's not easy. There's so many sources of information out there, and it's really hard to wade through it all. There is a great link, and I think we're going to post the link. There's a website called immunize.ca. And they have a really great resource. And really what it is it's just a set of really great questions that you can ask yourself when you're reading information that allows you to kind of determine, is this really reliable, or is it really kind of more misinformation or a single source that really isn't backed up by the evidence. And it lets people sort through for themselves, and because it does feel better to make the decisions that you've made for yourself that are based on the correct information, and really helps guide people. So I think we're going to post that link in the chat. And really just in general about getting vaccinated, getting vaccinated, it is definitely a personal decision, but it does have consequences for all of us. And in order to put an end to this pandemic, we really need to reach that critical herd immunity. And the way that we can do that is by getting vaccinated, by encouraging our family, our friends, our community to do the same thing, because that way we'll be taking care of ourselves and we'll be taking care of others too.
AJ, really good words, and the immunize.ca site is posted in the link.
Awesome.
I'm going to throw a slightly different lens on this. I was in a meeting today with a dozen of my physician colleagues. 3 of them were ICU physicians. And because we're all on the same board, we do a lot of chatting, and they have really expressed through chat how difficult things are. We were talking about mandatory vaccine policy, and the ICU physician from Edmonton, where they're really being overwhelmed right now, said, here's what's happening right now. The ICUs are filled with people who have got COVID, and all of those people in my ICU are unvaccinated. Those unvaccinated patients are pushing other patients out of ICU because we are now starting to triage. And, he made the point, we have to communicate to people that are unvaccinated that your decision to not be vaccinated is pushing other people's surgery back, is threatening ICU access to other people. So the decision that you make to not vaccinate is having a big impact on other people. Now, obviously, they're very emotional right now about the acuity of patients that they're seeing, and that position was pretty visceral. But I think it illustrates an interesting point that a decision to not become vaccinated or immunized does affect others. But Patricia, who's working with us and helping to communicate to patients, has texted me and said, guys, this was about return to school and how's that going to affect COVID? And OMG, most of us on the line don't have little kids, but our token Scotsman does. So Ian, tell us about what it's like being a parent with young kids and going back to school. And do you think that they're ever going to get immunized, as Patty asked?
Thanks, Rick. I'll take this opportunity to say,
I think they might be watching. Juniper and Torrin, if you're not in your jammies yet, it's time to get your jammies on, brush your teeth and go to bed. We've had a bit of a roller coaster ride back to school. I've got a kid in grade 1 and a kid in daycare. We have cold symptoms going through our house and COVID tests that are all negative. And this is what I mean when we say you're going to have other respiratory viruses. And so don't panic when your kids come home with a runny nose. Go to the Alberta testing website. Again, it's very easy to find. You just Google Alberta COVID testing and it's the first thing that shows up. Figure out, does your child need tested? Do you need tested when you've got symptoms? And just making sure that you're doing that. Because what we don't want is kids going to school without having had a test and potentially spreading COVID amongst their classmates. I remain unconcerned about how sick kids will get. My major concern throughout was whether kids would end up passing this on to their elderly relatives and killing them. That is not an issue if they're vaccinated. Those people have the opportunity to protect themselves. Otherwise, I think the schools have done a great job in terms of managing the risk. I was glad to see that we are having masks used, certainly in my school, and our principal's done a phenomenal job in making sure that happens. Yes, I understand some of the school boards maybe didn't. I think the further restrictions from the province will hopefully make that a little bit more difficult to get around, and masks will be worn by everyone because masks do work. And let's face it, such a something Jana said, it's such a simple thing to do. And I found, honestly, the kids, it's just another rule that the grown-ups make up, isn't it? My 3-year-old's delighted when he's got his mask on. So, I've got to wear a mask, okay. So yes, it's stressful, but you know what? I don't think it's as stressful and troublesome as it was this time last year. My understanding is that the Pfizer and Moderna trials in under 12s are looking at potentially reporting that. I read that the US might have an approval for over 5s by the end of around Halloween. Health Canada probably won't be too far behind that if the past has been out to go by, and then potentially towards the end of the year for those kids from 6 months up and over. So that data is coming, and I think the main value in protecting our children is protecting the rest of the community. You need to get a high enough level of vaccination, as I've already alluded to, in order to get the real true benefit of those vaccines for everybody. It's a public health measure. It's like a smoking ban. It helps all of us. I'll speak briefly again to what you've just talked about with the knock-on effects. If you're waiting to see some outpatient procedure, say for example a colonoscopy is needed, I think that's going to be delayed because of what some other people in the community, so their right to free choice as to their vaccine is unfortunately impacting on your right to timely access to those healthcare things. There's a lot of ethical dilemmas when it comes to rationing of healthcare things, and I don't think we should ration those, but we also have to be sensible and play along as a community. And you can maybe speak to see if your experience was the same. I found that some things moved faster when a lot of things were locked down in March and April. A lot of the surgeons couldn't operate, so their non-operating time was spent doing Zoom calls with patients to follow up or to assess their problem if they didn't need to physically do something. So it may be that if you're waiting for that conversation with an orthopedic surgeon, you might have that conversation sooner. I don't know. Did you find that in the spring as well, Rick?
Yeah, conversations happen quicker, so you got to talk to the specialist. But if they were going to do anything to you, you had to wait longer, and we're still sort of working on that backlog, and that backlog is now going to be increased due to the the shutdown again, or the suspension of elective procedures. Ian, I don't want to let you off the hook. Adam's comment is there evidence that this masking is going to somehow affect kids' development and their ability to communicate and missing social cues? Do you have any thoughts on that?
Yeah, Adam, I recall this being, I was listening to Alberta at noon back in the spring of, must have been last year. And they had a pediatrician on talking about it, and they started saying, oh yeah, it's going to do this or it's going to do that. And a blind gentleman called in. He's been blind since birth. Had no problem. I think he was fluent in 6 languages. And so I do not remotely worry about the effects of children wearing masks. I think that the personal experience of that individual actually fairly well, the pediatrician on that was like, actually, I feel that I've given the wrong information here, and apologise to the gentleman. So really I wouldn't worry about that. The benefit of wearing a mask to the wearer and to those around is huge. And so please just wear your mask.
Great advice. And we are coming to the end of the time we have together. I note in the chat that Jeannie from down in the medicine shop has reminded me to remind you guys that our pharmacists are a great source of information as well, really accessible. And thanks very much for that, Jean. I guess I'd like to just, a quick for Julia, do vaccinated people pass on the virus? The answer is yes. There is a viral load that's quite significant in vaccinated people who do have COVID, but the duration is shorter. And of course, if the people around are immunized, then their likelihood of being infected by that virus is lower. So net sum is it's still a good thing.
Can I throw in one last quiet thought about the kids getting vaccines? I finally remembered to book
my 3.5-year-old his 4-year shots, and it was actually very straightforward and very easy. I called my local public health office, and the lovely lady there was like, yeah, we've got lots of appointments. You may not remember that because, people are very good at getting them up until that 1 year, 18-month shot, and then they forget. So it's usually just before your kids start school, there's a booster due or around about age 4. So if you're someone that knows someone or has a kid that age, we may not have seen you for a routine child check to remind you. So there's your reminder. If your kid's at that age, get them their preschool boosters done.
Thanks, Ian. 3 minutes left and 3% left in the battery in my laptop. So listen, I just want to go around the table and get some final wisdom from each of you. Just a quick final thought that you'd like to leave the group with. Amin, we'll start off with you.
Thank you, Rick and the team. My main message is everyone out there, please get vaccinated. And if you have any problems with long COVID or anything like that, please see your physician. We can help you get tested. We can help move things along. So everyone out there, please get vaccinated so we can move on and move away from this pandemic.
Great words, and I'm sure that's the only time that theme is going to come up. But no, I love it. I have to repeat it 3 times, right? So good. Dr. Gillis, Lynn.
I want to just very quickly talk about mention one other thing that I don't think has come up a whole lot is, yes, we want everybody to get vaccinated, but please, everybody, be kind, do not judge, do not shame. There are some people out there not getting vaccines because they don't like being told what to do. Don't be kind to each other. We don't know why somebody isn't wearing a mask. We haven't lived their shoes. We don't know their situation. So be positive, please. Thanks.
Thanks, Lynn. Great words. JR, Janet, Dr. Reynolds.
Yeah, well, it's tough to follow that. So I agree, get vaccinated, wear your mask, wash your hands, stay home if you're sick. We are here for you. And I think, sometimes we need a bit of a break. So I'm going to make a recommendation that you all watch Ted Lasso, because kindness comes through in every single episode.
I'll add that to my list of 2 watches. Shauna, your wisdom for the group.
Yeah, I don't know that it's earth-shatteringly different than what everybody else says. So of course, just reiterating what I said earlier is around compassion and empathy. But I think about, Marinenci and what he tells us all the time, which is clean hands, clear heads, and open hearts. So, and second for Ted Lasso.
Sounds good. Ian, because my mother told me that you always have to give the last word to a nurse, let's give you the second last word.
So I get the second one. Okay. Confused. My wife would say it's never let me have a word.
Tolerate, probably sensible. I'm just going to echo the be kind. Lindsay Jancy was one of our former docs here. She's now the program director with the residency program. She sent an email out to all of us earlier this week, basically saying that to lead off, just be kind. I think she's a very smart lady, and I consider her one of my mentors, and I'm very glad to say that's a very sensible piece of advice for all of us. Yeah, we don't know. A lot of people truly are terrified of things like vaccinations, and our job is to try and help them to get to a better place. I think there are some that are not, and they're doing it because of their political views or whatever, but we don't know. And so be kind, look after each other, and if you're struggling, call us.
And Nurse AJ, as advertised, the last word to you, I got to say though, washing your hands has been taken. So can't be.
Okay, well then, I just really wanted to remind patients that it is important and it's healthy to set boundaries. COVID speak is everywhere. It's impossible to get away from, but also, and it's important to be knowledgeable for your health, but it's also important to recognize when it's time to step away, to turn off that TV, and to pick up a book, to do a puzzle, to, communicate and connect, and to be kind.
Really good, thanks. And also wash your hands though, right? That's still important.
Sure, no, yeah, absolutely. So, yep, wear a mask, wash those hands, social distance, and
right on.
And call us if you need us.
Right on. Hey, listen, that's the end of the hour. Thanks very much. I'm just so proud of my team here, the ones that are online and the ones that are sitting at home watching us and throwing darts at their screen, but we'll be here tomorrow morning bright and early to help you, and really appreciate our patients. The input that you've given us, the grace that you've given us when we haven't been as available as we'd like to, and joining us here tonight with great questions and great comments. Hopefully we won't do a lot of these COVID talks in the future, but we are planning more webcasts. So stay tuned for more information on that. The wizards behind the mask are behind the curtain. Trevor and Meredith, thanks for making all this happen, and Patricia for keeping us all in line. Good night, everyone.